Hello and welcome, and thanks for being here. I'm sorry if there's been any confusion about the links, but we're very glad you're here. We are very excited to return for an in-person fall of 2021. We made it through a very tough last year together, actually a year and a half really, and it's due to the resilience and the hard work and the commitment to the community. And I want to thank each and every person for your work and your resilience and your commitment during this past period. In the fall, our goal is to have a near normal PACE experience. We're here today to talk about what that will look like and how we'll make it happen. Brian Anderson is going to walk us through our plans and policies for the fall. Matt Renna is going to talk about return to campus expectations. And there are going to be other people who are going to be sharing thoughts about how we go forward. But first, I wanted to share some good news. The official announcement will be later today. Now as a sneak preview. The Board of Trustees unanimously endorsed the strategic plan yesterday. This has been a big effort involving our full community, much work on the part of many, many people. Thank you to all of you who've been involved. There are continuing to be opportunities as we think about PACE forward, and I'm very excited to be part of that effort with you. So, thanks so much for everything you've done. We're looking forward to seeing everybody in person this fall. And now I'm going to turn it over to our Provost, Vanya Quinones, and we'll see you later. Thank you.
Hello, everybody, and thank you, Marvin. I'm so excited that for the fall 2021, we're expecting that it's going to be close to normal. So we have to celebrate what we have accomplished and during the last year and a half and the commitment and your hard work for the institution. Thank you for everything you have done. I just want to go through some dates. So effective July 1st, we are removing the mask and the distance requirements on campus. Mask wearing is a personal decision. Effective August 16, everybody will be required to be vaccinated. That includes staff, faculty, and students in order to be in our campus, any of the campuses. There will obviously be exceptions for medical and religious reasons, and we will make accommodation for people that need those exceptions. We're looking forward for an in-person class, in-person activities, to be back to sports in Pleasantville, to have performance in New York City, to go back to our product, which is an in-person product. That's what the students are looking for, and I think that that's what we need to provide support to our students. It's going to be pretty hard for them coming back from a year and a half of online, and some students, will need more support. So we're looking for each of you to help us to go back to our vibrant community. I'm grateful for the commitment and the resilience throughout the year that you work so hard, and we all need to get vaccinated and upload our vaccine records and just embrace the in-person experience for the fall to be sure that we will continue to be successful as we always are. Brian Anderson is going to lay out our plan and policies for the fall. Then Matt Renna will talk about return to campus, and there will be other questions, sections of questions. So Brian, is all yours. Thank you.
Thanks, Vanya. I'm happy to be able to cover some of our policies and procedures that were outlined in this Tuesday's announcement. As Vanya mentioned, PACE will require COVID-19 vaccination for everyone in our community, our students, staff, and faculty. Sorry, that will be coming to campus starting August 16th. So let's talk about how we get there, what the process will look like, and what the key steps along the way towards that August 16th entry requirement look like. As Vanya mentioned, our first key date is July 1. On July 1, on all PACE campuses, masking and social distancing guidelines will be lifted for any individual that's fully vaccinated and has uploaded their vaccine record. Just a reminder, fully vaccinated per the CDC means it's 2 weeks after your one shot of the Johnson & Johnson vaccine, or 2 weeks after either your second shot of the Pfizer or Moderna vaccine. Other things that will be happening July 1, we are going to be lifting our pandemic capacity restrictions in all PACE buildings. This will expand our ability to increase occupancy for in-person classes, as well as in-person meetings. We're still looking at our visitor policy, so more to come on that. It's in development. For all individuals that will be accessing campus, we still need to complete our PayState health screener or the online health screening. That's going to be a requirement for all individuals, whether you're vaccinated or not. For individuals that are not fully vaccinated, they are responsible for wearing their face coverings, their face masks, and observing distance per state and CDC guidelines. Testing will be available. Anyone that's not fully vaccinated will continue to be in our testing pool. Individuals that are fully vaccinated will be allowed to be exempt from the testing at this time. Our next major date will be August 1. August 1 is the deadline for uploading your vaccination record. It's also the last date that you can get a shot to meet that August 1 deadline. So just depending on what shot you get, you should really contact your healthcare provider. They can walk you through this, but each shot or series of shots has a different time frame between the shots as well as periods afterwards. So if you're looking to get the Moderna vaccine, you'd have to get your first shot right around July 3. The Pfizer would be right around July 10. And J&J, you could actually get on August 1st and upload your record on the same day. Full instructions for uploading your vaccination record were in the Tuesday announcement. They're also available on the PACE website, pace.edu/return. And to upload your vaccination record, your vaccination card really serves as that. Alternatively, if you get any sort of documentation from a healthcare provider with your name, the healthcare provider's name, the date of vaccination, vaccine manufacturer, as well as the lot number, that could be used as an applicable record. So we are using the Medicat system. That's our confidential patient portal with University Healthcare. It's the same system that we used this past spring to upload our COVID test results in a very, very similar process. So any sort of vaccination record does need to be in English. So if you do get it out of the country, it does need to be translated by a licensed healthcare provider. And just one note, it can take several business days, up to 7, to have your vaccination record reviewed and approved by Medicat. And you need to receive confirmation from Medicat before you're able to enter campus on August 16th. Quick note, we are working with them to resolve an issue where we do have some individuals that have already uploaded but haven't received their notice of upload and approval. We're working through that with the vendor now, and the automated messaging issue should be resolved very soon. So continue to check your PACE email for any sort of updates regarding your vaccination record. Our next biggest date is really that August 16th, when anyone entering campus will be required to be vaccinated entering campus, except for those with an approved medical or religious exemption. On the 16th, we're still going to continue with our community testing. Most vaccinated individuals will be exempted from that community testing pool under our current conditions. Certain high-risk groups will continue to be in the testing pool. And if an individual is vaccinated and does want to get tested, they will be allowed to do that. So we're going to open up the testing to anyone. So it will be optional for vaccinated individuals as well. But really on that August 16th, unless you're vaccinated, fully vaccinated, you won't be able to access campus without an approved exemption. So what does it all mean? We're returning to normal, well, a more normal. And the vaccines to protect our community, ourselves, and each other. And we're looking forward to seeing everyone back. Now I'd like to turn it over to Matt Renna, who's going to discuss more return to work details.
Thanks, Brian. That was a lot of great information. I want to remind everyone that any information we send out on email or that we discuss here is available at the pace.edu/return website. So please make sure you keep up with emails and looking at our website. I want to welcome everyone. You just heard from Brian all the rules for our 2020 reopen. We're excited about coming back to that sort of quote new normal or normal that we're all used to being together. And I know things have changed, but let's talk a little bit about that. First, I want to acknowledge that many of our faculty and staff have been coming to campus for the past 16 months, and I want to express my appreciation for your continued support of our students and the entire community. It was so important, your function, to be here, to do what you had to do during this time period. So we're really grateful for that. I want to set the context to our return to campus, and I want to talk about how, since really the start of this pandemic, we as an institution, as a community, have really focused on the safety of our community. And our decision to mandate vaccinations is very consistent with that approach. So we want to keep everyone safe, and this is something that we're seeing across all of higher education. We always take into account information that we're getting from the CDC and local health officials, and we want to also see what our colleagues are doing across the country. So what we're doing here at PACE is very consistent with creating a very safe environment for our faculty, staff, and students. So you're going to hear us say this probably more than once, but 2021 is going to look closer to 2019 than it did to 2020. We're trying to return to what we were, which is predominantly an in-person institution. That's who we are. And so as such, faculty and staff in general are expected to return to campus to support our students and our community. However, with that said, there will be instances where staff will not be required to be on campus based on their job function and at the discretion of their supervisors. So there's a lot of work to be done in the next a few months to get ready for the semester. So you'll be working with your supervisors to determine exactly what your job function and whether or not you need to be here because of what you do, or you can continue to work remotely. So working remotely will continue to be available at the approval of your supervisor and in consultation with HR and our university guidelines for working remotely. But remember, our goal is really to continue to support our students. So there are many positions that really require that interaction with them that we will need you to physically be here on campus, including and I'll let some of the others on the panel speak to more about the sort of in-classroom and the instruction side of the campus life. So HR will be sending out more information about the return to campus guidance. We're just building it as we've gotten these final new guidance about mask wearing and all the social distancing. Again, safety is our priority. We're building that into the return to campus. So guidance will be coming out shortly to really help you understand a little more detailed about what we mean about that. That guidance will also include information about applying for a reasonable accommodation. We want to make sure people are safe, and we want to make sure that we're compliant with the law and that we provide equal opportunity to everyone. So that information will be available as it is now. It's been out there, but we're going to provide that to make sure everyone knows exactly where to go to get that information. So now I'd like to introduce our panelists. You've already heard from Brian. We have Joan Walker with us, Marcy Kelly, Angie D'Agostino, and Vanya Quinones, as well as our moderator, who will be Sia Bundor. She's going to moderate the chat, so please put your questions in the chat and we'll try to address them as efficiently as we can. Anything that we can't get to, usually what we wind up doing is trying to get that information out to that website I mentioned, that pace.edu return. So whatever we can't get to today, we'll try to get that information out to the community through either email or through that channel. So welcome everyone again. Thanks for taking the time and participating. So now I'll turn it over to Sia and ask Sia, what is our first question?
Thank you, Matt. So the first question that we have in the chat is, will there be a social distancing requirement in a classroom? And if so, what is the requirement? Joan or?
So for unvaccinated individuals, they are required to follow mask and social distancing requirements currently under CDC guidance. That will remain in effect. That's their responsibility. But as far as having a classroom where there's 6 feet between every single chair, that's a model that is changing. So the furniture is coming back into the classrooms to accommodate the students in a larger setting.
Thank you. Next question. What's the plan for teaching students who refuse or can't get vaccinations? Will all in-person classes be required to offer high flex options?
The short answer to that is No. The longer answer is we are offering courses in a variety of modalities as we have for the past several semesters, fully online, hybrid, and fully on campus. The curriculum and the learning objectives for different classes lend themselves to one of those modalities better than the others. So we are leaving it to the academic programs to determine what they think is the best delivery model for their content and their faculty's expertise. That means we may see a great deal of change in how courses were listed when students registered in the spring. And we are asking folks to make any changes that they may be making in instructional modality, to make those within the window of July 1st through July 15th. So then the registrar staff can make those changes available with the goal that an updated fall 2021 schedule would be available August 1st.
Thank you, Joan. We have a few questions about how will we know if an individual is not vaccinated? Will we be notified as a supervisor or as a faculty member?
No, I'll defer to Brian on the language on that. That's personal health information, and we would not disclose that ever to anyone.
That was the language I was going to use. There's no safe mechanism for someone's safety to say whether they're vaccinated or not and share that information. That's totally personal information that we can't share and use to ostracize other people.
May I?
And just because you see somebody with a mask doesn't mean that that person is vaccinated or not. So mask is an optional and behavioral decision of each person. So members of the community could be with mask or without mask. So please don't assume that people are vaccinated or not. So I just want to clarify that.
May I also pose, as a chair of a department and also someone who teaches, who's going to be teaching a large class in the fall, I just want to highlight that I'm going to be working with my department to find out from my faculty what their preferences are for modality for the fall. And we're going to be making those decisions based upon the best pedagogy that we can offer our students. And so I just want to put it out there that that decision will be left to the faculty with consultation with the chair, associate dean, or dean.
Thank you, Marcy, and the panel. We have an additional question about social distancing in the workspaces. Is that something that's going to continue, or will there be changes made there as well?
We are expecting that the whole community will be vaccinated, and we are going back to normal levels of occupation on each rooms and each place. If the person needs more space, then we could accommodate that. For example, for classroom settings, maybe one section of the classroom, you could have a little bit more distance there. On sports events, we could have a section that is with 6 feet distance and another section that is normal. So we will we don't have any mandates right now on distance, social distance on institution. We're going back to 2019 space rules. So I just want to make it clear that we could accommodate it if it's needed, but right now that's our policy.
Thank you. Will we still continue to use the PayState Safe app for screening for vaccinated people after the deadlines that we mentioned?
Yes, we're still going to be using it. We still want people to check their symptoms daily, check themselves for symptoms daily, excuse me. If someone is ill, we don't want them coming to campus. We want them to be approved to come in. If they do need to seek medical attention, we want them to get that immediately and not come and spread anything on campus. So yes.
Thank you. So there's another question about newer vaccines. There's a mention of a Sputnik V vaccine. Is that going to be accepted?
Current policy is any vaccine that's approved by the World Health Organization will be accepted.
What should we do with, Matt, this question will be for you. What should we do with staff that are not compliant with vaccines and choose not to wear masks in the workplace?
So I think it's important to make sure everyone understands. So I see a couple of things on the chat. The mandate vaccine is being managed through the entries to our campuses, much like we did with the PCR tests. So the only folks that should be coming onto campus are those who are vaccinated, who have gone through the process to upload and been approved to come through with their approved vaccines, or those who have been approved to have either a medical or religious exemption. And that applies for students, faculty, and staff. So those that are coming onto campus that are not vaccinated really are limited to those that have gotten the religious or medical exemptions. They are required to wear masks and practice other social distancing. As Vanya said, there are going to be a lot of others, myself included, that are going to continue to wear masks. So I think we're asking the entire community to make sure you be respectful of those that to continue to wear masks in this process. So like everything that we do here, and I think across the country, we're relying on people to really follow the guidance. We can put in controls, and we have as many as we can put in place, but we're relying on everyone to make sure that they follow these guidelines. I think Brian had mentioned it, or he will at some point, that we will be having some testing available on campus, and the community is, even if you are vaccinated, you can volunteer to also get tested on campus. That's going to be an option available. So it's a challenge for us to make sure that, I can't follow everyone who's not who's gotten the exemption, not vaccinated, to make sure they're following the guidelines. But we're doing really everything that we can to make sure that we keep this community safe.
Thank you. We have another question, a different topic related to open areas in the fall. So will the fitness center and gym be open in the fall? And if so, what date?
I know the athletics department is currently exploring that. I don't think they've released an opening date quite yet. I know that they were open to students this past spring. So we'll have to get some more information on that for the group.
We have a few more questions related to the vaccine card and uploading the document. One is the person has uploaded the vaccine card and still says that it has more, they have more forms to fill out, and they're not sure what that means. And a question about uploading both sides of the card. So Brian, would you be able to assist with that?
Yeah, so with the vaccine record, if you are using that CDC card, the little 3x3 card that most people got, they will require both sides of that to be scanned and uploaded. You can just take a picture with your smartphone and upload it like that. So that's what I did, and I went through.
If you're loading an international vaccine record, it needs to be in English. So that's something, just a reminder for if anybody has an international and an international vaccination record.
And Sia, to go back 2 questions, Mike Wynn just added himself to the panel and confirmed September 1st, the fitness center will be opening for faculty and staff.
Thank you.
Thanks, Mike.
There's a question in the chat about those who work in external PACE sites, so PACE leases. Are we going to be ensuring that other companies who share the same building will have similar compliance directives in place?
Within our own space, of course, our guidelines always govern. There could be leased properties where they have, if there are, of course, more strict rules, then you have to adhere to them. If they're less strict, up until you reach our point of entry and where we can sort of govern that, then our rules sort of kick in. We're hoping, again, everyone takes the more conservative approach, always whatever is the safest thing to do. You sort of go by that mantra. I think that's served us well over the past 16 months. But we're coordinating with the leased property to understand any differences there are. But I think the easy answer to this question is once you're on our space, once you swipe to get into our space, you have to follow all of the PACE rules and guidelines.
Will the guidelines apply to outside vendors that work on campus? I'm assuming the answer is yes.
Yeah, our contractors will be expected to follow all health and safety protocols as well.
There's a few questions related to student and faculty dining halls. Will they resume operation, or will it continue to be grab and go or buffet style meals?
They're going to be bringing operations back to normal. I can't speak to the exact dining halls, but I know that it's not going to be just Grubhub and grab and go. So there will be additional seating within the student dining halls, but we'll have to provide some additional information.
There will still be some plexiglass on some of the tables if people feel more comfortable to eat behind a plexiglass. So, but the expectation is that things will go back to normal as 2019.
Thank you. There was a question about entering campus once the restrictions are lifted. Will there be any measures put in place at the security gate in Pleasantville to avoid a backup of vehicles, especially in the morning, for those checks?
Well, with the checks, once the vaccine is required, the security guards will be checking for people's IDs. The ID is going to be tied to your compliance. So the compliance means either you've uploaded a vaccine record or you've uploaded an approved exemption. So all other individuals will be turned away. That's why it's important that you're actually uploading your vaccine record ahead of time so the system has time to process. As far as the daily health screening, that's something everyone should be doing before they get to work. When you wake up, do it at your residence. Please do not do it at entrance 3. That's going to be causing the backup. It is a little clunky, but it's a process that's in place to keep us all safe.
Thank you, Brian. There are a few questions related to the equipment in the classrooms. Will the classroom be equipped with additional AV or microphone equipment to facilitate the participation of students who will not be vaccinated? And there's a question about the improvement of ventilation in the closed classroom spaces. Brian, would you be able to speak to that?
So as far as ventilation in the closed classroom spaces, facilities has upgraded all the filters to the MERV 13. They're going to continue with that operational change. So the MERV 13s will continue throughout this year. What was the first part of the question? I'm sorry, Sia.
I'm sorry, it was related to
In the chat.
AV equipment also being available. I think Joan had touched on that before.
I can take that, yeah. So I've seen a few questions in the chat about this, so I'll try to knock a few out. All Zoom stations will remain in the same classrooms they were in place in the previous academic year. In addition, all classrooms have the capacity for Zoom, even if there is not a Zoom station in the classroom, and that is for deployment at the instructor's discretion to accommodate any absences. We have a number of ways to accommodate occasional absences, and we'll retain those. The AV question, if you have additional AV needs, you can certainly ask Ed Media for support with that, and they will provide additional equipment. But our classrooms will look pretty much the way they did before. The Zoom stations will remain. And if you want to use Zoom in a classroom without a Zoom station, it will be possible to do so.
Thank you. Brian or Matt, there's a question related to visitors to campus. Is there going to be special restrictions for those individuals?
The visitor policy is still being developed. They will have additional restrictions. The form that they're going to have to fill out will have additional fields and information that they do need to provide to the university.
Thank you. For those using the Pace Shuttle, will there be additional checks in place for the shuttle before they get to campus?
So there are certain industries that are still under state guidance. Healthcare is one, public transportation is one, where masks are still required. So masks will still be required on the Pace Shuttle. They'll be required if you enter the university healthcare unit. So there will be some additional safeguards that remain in place.
Brian, I just want to go back to the visitor question answer. I recommend everybody to keep checking the webpage, Return to Campus, because all of these policies and all of these forms will be available to the community. We usually send them by email, but that's the place to find any form or any policies on visiting, traveling, and all of these other questions we have. Sorry, I just want to remind people that that's the best place to get information.
Thank you. There were a few questions related to the deadlines for vaccination. Can you just reinforce those, Brian?
Sure. So the first deadline is the actual upload of the proof of vaccination. That's August 1st. And what that means is you need to upload the proof of your vaccination. It doesn't mean that you need to complete those 2 weeks post your second shot. So that time is built into the August 16th campus entry. So the last day you can actually get the J&J shot would be August 1st, upload the record the same day. Or if you do a different vaccine series, the last day you can get one of those shots would be August 1st and upload same day.
Thank you. Matt, can you speak to the accommodations and exemptions? Are there any deadlines related to submitting that information and approvals?
So there's really I want to be clear on sort of the two different processes here. So there's an exemption that you can apply for from getting the vaccine, and that's related to either your religious beliefs or a medical, for a medical reason. That is being handled through the patient portal. That information was sent on the email from earlier this week. And so you can fill out the appropriate forms that were sent, and that goes to a Medigap provider that will review the information and either approve or not approve of that exemption. Ongoing, the university has had a reasonable accommodation process, which is a broader process about making a workplace accommodation. And that continues to be available to our faculty and staff as needed. And they should just email employeerelations@pace.edu if they have any more information or need more information, on what that process looks like and how to go through getting a reasonable accommodation in the workplace.
Thank you for plugging our email address, employeerelations@pace.edu. Thank you. There was another question related to the in-person campus restrictions being relaxed. They asked to expound on that. I think we covered it, but if there's any additional comments on that, that'd be great.
Sure. So, I mean, the main two biggest items are really the distancing and the mask use for those that are fully vaccinated. Other things that we're going to be seeing more of that we saw in a lesser capacity this past spring, in-person events. So students are going to be able to have greater events. We're going to be able to have more people at them. In-person classes, occupancy will increase. We'll actually be able to sit across a conference table with each other and work together now. Dining hall will resume more of its normal operations. And we'll actually see, hopefully be able to sit in Pace Stadium and see some sporting events. So it'll be good to cheer for our setters and just return to a more normal.
Thank you. We have a question about the religious exemption. Are there going to be any definitions or additional information related to what would be classified as a religious exemption? And if so, from whom?
Sorry. The information for the religious exemption is explained in the actual exemption request form. And that's going to be reviewed by Medigap as well.
Thank you. We have a few more questions. So there is a question about the academic schedule. Will there be some academic breaks of any kind? And that's a question for the group.
The academic schedule was approved by the calendar committee and both faculty councils. It's available on our website. I'll chase down the link and point it in there. It looks like a regular fall semester.
We will have spring break, so make appointments for Cancun. Here I come. Just reminding everybody, I'm going to Cancun.
I see something in the chat about a few individuals have uploaded their records but haven't received it from Medicaid. So this is an issue that we're working through. You don't have to re-upload at this point. The system was built for students, and faculty and staff are required to upload as many vaccines, so like MMR and other things of that nature. So we're tying the compliance just to one vaccine record for faculty and staff. So we're working through that, and you should be getting the automated messaging in the coming days. So just continue to look at your email. You don't need to reach out and say that you've uploaded it and you're waiting, but we have the issue resolved in the coming days.
Thank you. There was a question about additional mental health support for students that are coming in this semester. In addition, will there be any training for staff and faculty on supporting those students when we start our new return to normal? Joan, Matt?
So we are expecting that the community overall, not only the students, but our peers, our colleagues, this situation has been pretty stressful, and there's going to be residual mental health issues that will last for much longer than the pandemic. Similarly, the students that are incoming students and current students at PACE also have issues due to extended period of being at home with their, not socializing, et cetera, et cetera. So we are aware that the support that we need in terms of mental health and also the support in terms of learning outcomes, because you have a lot of students that were taught online for a year and a half, and maybe the support was not the same as prior years. So we're getting ready to put supports on those areas, increase the support on the learning center, the mental health services, and to coordinate the effort of wellness in the whole community. So we're aware of it, and we find that this is going to be a challenge, a post-pandemic challenge that we all have to work together. And as a community at PACE, we will be successful achieving our goal to ensure that everybody's healthy, but we will work together on this. So yes, the resources are there, we're aware of them, and we're increasing learning center support as well as counseling service.
And to piggyback on that, there was a specific mention of the counseling center being available to the students. I wanted to make sure that it's available on an as-needed basis. And we'll try to put their link to that information in the chat for attendees.
We have a new system that is called the CARE report, in which if faculty or staff have any concerns about students, you make an electronic report, and a committee will help with the situation and follow up. So that resource is also there for the whole community too, in case you have a student that needs further support, to let us know and we will follow.
I'd like to add that all faculty and staff, regardless if you're enrolled in our Cigna program, we have a Cigna Employee Assistance Program, the EAP, that's available, provides a plethora of different services, one of which are sort of support with mental health for yourself and your family. It's free, it doesn't cost you anything, and they'll provide, I believe, up to 3 counseling sessions before they transition you to your sort of primary insurance, whether it's with PACE or elsewhere. But it's a great service. It's available to everyone, and it's there for you. So we're trying to provide the services to everyone. We acknowledge that, as Vanya just said, we know that the entire community, I know our students need the support, but we all need the support too during this time as we do kind of get back to what we're hoping is normal. So please take advantage of all the services. Keep up with with not just the EAP. We send out an email every Tuesday with a lot of health and wellness, different events that you can do that really kind of help you and address as much as we can, the needs that we're hearing from you, the community, as things you'd like to see. So take advantage of what we offer. Take a walk, take a break, make sure you do things to take care of yourself. We're so appreciative of the 150% that you've given over the 16 months, but we want you to take care of yourself. And it really is important to step back when you need to, and do what you need to do for you. We need you at your best. And so you can only be at your best if you do take care of yourself.
Thank you. We have a question related to cleaning services. Will the cleaning of the offices and common spaces be the same, or will they be more relaxed as well and going back to pre-COVID procedures?
Our goal is to go back to pre-COVID procedures. There will be an enhanced cleaning, but not at the level of the last year and a half. So we'll be back to 2019.
Yeah, facilities will be following, I think it was the February CDC guidelines that were issued for cleaning of facilities.
I think we touched on most of these questions. I think we're winding down on the last question. I think there's a question related to flex work arrangements. Again, Matt, if you can touch on that. Will they continue to be offered? If so, is there specific schedules that managers should be using?
Sure. So like I said earlier, we are predominantly an in-person institution. We're looking for folks to really return to campus, create that vibrancy that our students expect when they come here. With that said, there are some jobs and positions that need to be here, and there are others that can work remotely. We learned a great deal in the past 16 months of what positions can be done effectively remotely. And that's also a person by person. Some of us really thrive in being together, and others can do their jobs remotely, and can be done because maybe they're not interacting with as much folks. So it's harder for me to give a sort of a broader answer that will affect everyone. Is that we really want to use common sense and be smart about how we approach this. So we're asking sort of, as we talk about returning to campus, people think about returning to campus. At the same time, we're trying to eliminate some of our physical space to save some money. So there are going to be opportunities for folks that maybe don't interact with students or don't have as much community interaction to work remotely more than others. So I can't give one answer to everyone. So what I'm going to say is what I said earlier. You really need to work with your supervisor and take it on a case-by-case basis to see what works. Do you have the right equipment? Have you been productive? Have you been effective working remotely? We're going to provide all this guidance so that supervisors and everyone understands what those sort of details are in that decision-making process to determine, who can work remotely. I do think remote work is going to be a part of our sort of workforce to stay to some degree. But that has to be done, like I said, working with your supervisor, in agreement with your supervisor, and also in consultation. We're going to support everyone here in HR. And in consultation and support of our university policy. So we want to make sure that this is done in a way that is consistent across the entire university. So more to come on that. I know everyone's that's a big question. Everyone's kind of on their minds about that, but there will be more to come shortly to really help people understand that process. But everyone should be prepared to return probably in some capacity. Whether that's 5 days or not 5 days, everyone should be prepared. And even those who may get approved to work remotely in a greater scale should always be prepared to return to campus for in-campus events and meetings. So if you're thinking, hey, I'm going to move to Hawaii and sort of park myself there for 12 months, that's probably not going to happen and as an approved work from home. But we were going to be smart and strategic and use a lot of common sense in how we approach this.
Thank you, Matt. I think we have time for maybe 2 more questions. So the first one will be, will faculty be required to provide recorded classes to students who are not returning to campus? Joan?
The short answer to that would be no. If students know they cannot come to campus they can sign up for online classes or hybrid other forms of classes, and work with their instructor in terms of how much actual on-campus participation is required and for what kinds of activities. The safest bet for students who cannot come to campus is an online course. However, there may be accommodations that hybrid classes or other classes can make, and that's up to the programs and faculty to decide.
Thank you. And last but not least, where can we access the recording of this particular town hall? Or will it be offered as a recording? A posted recording, excuse me.
I am gonna jump in, and all the town halls and all this information is usually posted on the Return to Campus webpage. So any information, including this web seminar, will be posted in that page.
Thank you to the panel, and Matt, I'm going to direct the conversation back to you.
So I think now, Marvin, your turn.
You're unmuted. Go ahead.
No one? Oh, hi, hi, everybody. I'm now at the I'm at the law school sharing Angie's screen. But anyway, I did want to say that as Matt and others and Vanya have said, that we're just really, really grateful for the extraordinary effort that everyone's put in. And we continue to be responsive to New York State guidelines. I think Vanya said to continue to look at our website. New York State guidelines will govern the way we operate this fall. So there may be changes even along the way. Brian Anderson has done an extraordinary job, as has our faculty frog reopening committee, and Marcy's done a wonderful job. But it's a work in progress, and we're doing our very best to keep everybody informed. We will do more of these as the need warrants, and please just check back with us. And thank you all very much for everything you've done. And we look forward to seeing you this fall.
Thank you all, and stay healthy. Bye-bye.
Bye-bye.